We are hoping that the paper of 3 versus 6 will be published soon. The data hasn't changed much since last presented, which is good. Our understanding right now of how we should treat patients in the adjuvant setting with stage 3 colon cancer is as follows. If the patient has a low-risk tumor, N1 or less, those patients, or T3 or less, those patients seem to benefit from no more than 3 months of chemotherapy. So this is the 3-month advantage. Patients would either go on FOLFOX or CAPOX and would have about the same benefit with much less toxicity than 6 months. So for patients with T3 N1 or less, so lower risk patients, 3 months of chemotherapy is probably as good as 6. And that, in my clinic, that's what I do to my patients. For the T4 and 2, so the more aggressive tumors, 6 months of chemotherapy is probably a little bit better, not much better, a little bit better. And interestingly, when we look at the data with CAPOX versus FOLFOX, the data with CAPOX for 3 months versus CAPOX for 6 months seem to essentially be at the same level, meaning 3 months and 6 months of CAPOX seem to do equally well. So for patients with more aggressive tumors, stages T4 and 2 or higher, I think the discussion would become very important about the 3 versus 6. I mean, for the low risk patients, I think, frankly, 3 months, in my viewpoint, is relatively settled, and there's very little discussion there. But I think for the 3 versus 6, for the high risk patients, the discussion should continue with the patients. Of 3 versus 6, the implications of toxicities, cost, etc., of the 3 versus 6. The differences between CAPOX and FOLFOX seems to favor a little bit CAPOX for 3 months than FOLFOX. And also the importance of the toxicities that come from oxaliplatin. So the happy medium, I think for many patients, if they choose to go for the 6 months, or the physician who considers 6 months is consider 3 months of oxaliplatin-based therapy plus the fluoropyrimidine, followed by 3 months of a fluoropyrimidine to complete the 6 months. So I think it's a little bit more of a complex discussion, but at the same time, I think we have clues that we're really not going to a detriment by exposing patients with high-risk tumors to 3 months of CAPOX, with still a consideration to continue to the 6 months. But as I said, for the low-risk patients, 3 months suffices.